Hi guys, it's Mike here. I'm just putting together a little video here for you, just to give you some guidance and explanation on something you may be aware about, but it's something you definitely need to know about if you are engaging in any kind of physical restraint of persons, physical intervention, if you have to physically intervene as part of your work to keep you or even that person safe or others safe. And it's acute behavioural disturbance, or what we used to know as excited delirium. Sometimes people still do refer to it as excited delirium, but it can be quite a common thing that you might experience, like I say, if you do have to engage in physical restraint with someone. It's something we definitely need to be aware about. Now, acute behavioural disturbance is a medical emergency. There's no getting away from it. It really is a bad thing. Hopefully you never experience it, but if you do, you need to know how to respond, the best way to respond. There is no standard definition, but it comprises a triad of acute delirium, severe agitation. So that person's going to be very, very agitated and they're going to be aggressive. And you're going to see things like hypothermia. Now, hypothermia is where the person gets very, very, very hot. They'll get very hot and they'll get very sweaty. And that can create lots of things going on inside the body, which we'll talk about. It's usually associated with acute and chronic drug use or acute substance withdrawal. So someone could be withdrawing from a substance. They may not have had their fix. They may not have had access to their regular fix. So therefore, this could be what could trigger it off. But it can also be caused by other medical conditions such as hypoglycemia. Now, hypo meaning low, sorry, and glycemia meaning sugar. So low blood sugar, and that's what affects the brain. If it affects the brain, then the brain has a massive effect on the body. Low blood sugar or sepsis, which is otherwise known as blood poisoning. So if any of that poison gets into the bloodstream, it can affect the blood, it can go to the brain, and it can cause a lot of these symptoms, signs and symptoms, which we're going to talk about. Around 10 to 20% of cases of acute behavioural disturbance are caused by pure psychiatric disturbance, and sudden death occurs in around 10% of presentations. So 10% of people, these are the stats, will die possibly or will definitely get a cardiac arrest, which will bring on death if someone is restrained. And obviously the position that the person is restrained in plays a major part, which we're going to talk about that. But 10 to 20% of cases where sudden death occurs, 10%, not a good thing at all. Now, excited delirium syndrome has been recognised by doctors as a true medical emergency, in which a young obese male, often under the influence of psychoactive drugs, becomes acutely delirious and displays superhuman strength, rapid breathing, profuse sweating and severe agitation. Now, I used to work in the prison service and I've experienced this a lot, where I'd have to intervene with others to protect people from their own actions, basically. And I distinctly remember one time I was in the court of law in central London, and this person started scraping at their arms with a plastic spoon, tried to cut their arms open. So obviously we couldn't have that. We had to try and get that implement off him. We tried talking to him, but it didn't work, so we had to resort to physical intervention. And that person had also taken a cocktail of drugs that we didn't know of. So when he came in, the effects started to come on board. He started doing what he was doing, and we tried to restrain him, and he wasn't a very big guy, and he was throwing us around like rag dolls, and there was sweat coming down the walls. We managed to restrain him, managed to calm him, and you could wipe your hand on the wall of the cell and it was like a river. That was the amount of energy that person was giving off, but also we were expending a lot of energy. So our heart rate was up, our breathing was heavy, weren't thinking straight, and it wasn't a great state of affairs. Now, there is a prolonged and continued struggle, just like we had there, with police or care agencies, or in my case, it was the prison service. Now, cocaine effects. This is one of the recognised things. Cocaine is definitely a big contributor, but like we say, also other psychoactive drugs. Now, chronic cocaine use leads to dopamine depletion. Now, dopamine is a chemical that's released into the brain. It's the feel-good chemical. So if you eat a bar of chocolate, you feel good. Well, I do. I feel very, very good. And that's because it releases dopamine. And we need that dopamine hit. But if you really, really need it, then you become an addict. And that's why people have drug addiction, because they really, really, really need the dopamine hit. They can't do without it, basically. And therefore, effects also lead to what is known as cardiac hypertrophy and contraction bands in the heart, that the heart doesn't expand and contract as well because of the fact that the dopamine balance is out of whack. And severe acidosis and rhabdomyolysis. Now what that is, that's breakdown of skeletal muscle tissue. If the body isn't getting enough oxygen, it builds up acid because carbon dioxide builds up. And then if that builds up, the body becomes very acidic. And that stops the proper functioning of the lungs and the heart. And therefore you stop breathing. And that can be a really, really bad thing, obviously. And if we contribute to that by not allowing the person to get their breath, and we're going to be talking about positions that we could possibly put someone in which could allow that to happen. Again, it's going to lead to sudden cardiac arrest, which is something we definitely want to avoid. Now, the first recorded case of acute behavioural disturbance or excited delirium was in 1849, and it followed cases of psychiatric patients developing acute onset of agitation, mania and fever, and suddenly collapsing and dying. Now, in the 1980s, fatal excited delirium was further recognised in the face of the rising cocaine consumption in North America, and it was in combination with acute drug intoxication, so cocaine, but methamphetamine, PCP, LSD, and history of mental illness, especially paranoid schizophrenia and even bipolar disorder. Now, it could be brought on by, and it was usually brought on by, a struggle with law enforcement, and more severe than anyone anticipates, and intense, and even when a struggle is futile and self-mutilation is a result. So a person will continue to struggle. Their brain will not switch on to the fact that this isn't a good idea. I'm possibly hurt, or I'm losing oxygen. I shouldn't carry on. The brain does not register these warning signs. And this is the thing about acute behavioural disturbance or excited delirium. So some of the clinical features, the warning signs or symptoms. Let's look at a typical scenario. We've got an obese male displaying destructive or bizarre behaviour. It leads to a call to the police, and the police engage in a physical restraint with the person, maybe to protect others, protect themselves. Might not be the police, it could be a care agency, it could be absolutely any person or any organisation. These are some of the signs and symptoms. An increased pain tolerance. And that's where the brain, because the brain is not operating properly, it takes away the pain tolerance. It increases the pain tolerance, and it takes away the feeling of pain. So that person could be normally in a really bad state. I mean, they could have half their arm hanging off, but they could still fight on because they don't feel that pain. Sweating. They're using a lot of energy. They're using a lot of fuel. So therefore, they're going to create a lot more heat. Agitation, as we mentioned before, and hypothermia, which links in with the generation of heat. The muscles are really, really working hard, and they're tensing, and they're really, really tensing and tensing. And you're going to notice that. Non-compliance, ongoing struggling despite the fact that it's futile. They won't recognise it. The brain won't recognise it, and therefore there'll be a lack of tiring. They won't tire easily because the brain won't allow the muscles to recognise it. They'll have unusual superhuman strength, again, because the brain releases all those chemicals into the body, mixes them up, and makes the heart work harder, makes the lungs work harder, makes the muscles work harder, and so the person is running a marathon inside their body. Inappropriate clothing, e.g. nakedness, so that person is going to get super hot, so they're going to strip off. That's what the brain is going to make it do. So that brain's going to say, right, I'm overheating, let's get those clothes off. But we all know what happens when we sweat, and that sweat evaporates, especially in a cold environment. We're going to get cold very, very quickly. So hypothermia as well as hyperthermia. Hypothermia in the initial stages, but hypothermia can definitely kick in, especially if that person's removed their clothes. And the bottom one, positional or compression asphyxia. And we're going to talk about that now. So basically, number 4, if 4 out of the 10 listed are present, a person should be considered to be suffering from acute behavioural disturbance. It may not even be 4. Maybe 2 of those could be so significant that you consider that person to be at risk. So we're going to look at the management of acute behavioural disturbance and excited delirium. First is about agitation. We need to minimise the use of and time spent in physical restraints, using as many properly trained people as possible for as short a time as possible. Single person restraint is extremely dangerous. Do not get involved in it, guys. There's so many things that can go wrong, and they do go wrong. It's not good for the person being restrained, and it's definitely not good for the person doing the restraining. Far too much danger. You need to have the appropriate amount of people to manage the situation so that person does not get into a situation where they can't breathe because you've pinned them to the ground and you've stopped their lungs working, or that person is not properly controlled, so the person trying to control them is now at risk and ends up getting a beating. Hypothermia. The person will be rapidly overheating, so we allow controlled fluid intake, cooled fluids, and also ice packs for the neck, armpits, fans with mist spray, cooling blanket. Obviously we can't do this while we're restraining the person, but once we've got some kind of control, we need to try and bring their temperature down as much as we possibly can. Now, as you can see in this picture here, we've got an example of prone restraint where the person is pinned down to the floor, someone's putting pressure on their back. Now, as it says here, particular care should be given to ensuring a clear airway is maintained, as the airway can be put at risk if the patient is turned prone. That is an example of prone restraint, with pressure on the neck or shoulder to try to guard against spitting or biting. It's natural, but we don't want to be putting anyone into that position and pushing them down into the floor, even if we're not applying pressure to the back. If that person has exerted themselves so much and they're placed in that position, the diaphragm, which helps the lungs expand and contract, won't work, the lungs won't work, oxygen won't get in, and they're going to die. So we need to avoid the prone restraint completely. Do not restrain anybody in a face down position. This severely restricts the function of the diaphragm, as I said, not allowing the lungs to work. There are safer alternatives to this method of control, which we teach. We don't want you to get into bother like this. We can teach you much safer methods of control. And obviously dial 999 for an ambulance and police assistance. Make sure you've got the emergency medical services on the way, and make sure that you've got some other help. You can't handle this situation on your own. Make sure you've got some professional help on the way. Okay, that's a short video to help you out there, guys. Hope it has helped you out. But if you need anything more from us, you know where you can find us. Great.